First, we just want to say thank you for joining us to discuss a mission that is very important to all of us on this panel today, supporting survivors who have experienced any type of sexual violence. Today, we are here to talk about the work of YWCA's Dayton Rape Crisis Center program, where we serve survivors of sexual violence for Montgomery and Preble counties. We are invested in this work because of the prevalence of sexual violence and the need to support and help survivors in our community.
And we are specifically coming to you today because it is Denim Day. And Denim Day is a campaign that happens on a Wednesday during Sexual Assault Awareness Month, which is in April, where a case that went before the Italian Supreme Court was overturned because the survivor was wearing a pair of jeans. And they said, well, your jeans were so tight, so you must have had help taking them off, so there was consent. And because of that, hundreds of women went out to work the next day, went everywhere in a pair of jeans in support of the survivor. And so now nationally, it's known as Denim Day on April 28th, so that everyone goes around and we just wear pieces of denim to support survivors and know that consent is key and that you need to believe survivors. And so YWCA Dayton is dedicated to eliminating racism, empowering women, and promoting peace, justice, freedom, and dignity for all. And we do that very closely within the Rape Crisis Center program.
Now I'd like to introduce who's on our panel today. My name is Amy Dudley, and I'm the Associate Director of the Rape Crisis Center for the YW. And we have Megan Garrison, who is a sexual assault program educator and preventionist. We have Leslie Empostado, she's our Crisis Service Manager. We have Miranda Armstead, Rural Advocate in Preble County. And we have Monika Thomas, Associate Clinical Director. Thank you for joining us, ladies.
Thank you.
Thanks. And so to talk a bit more about what the Sexual Assault Program or the Rape Crisis Center program does at YWCA Dayton, we have a number of services that we do to basically support survivors within the community and also to educate and prevent sexual violence. So one of those is we have our crisis line, which is ran by crisis support specialists that are able to help individuals that come in. We have counseling services in a partnership with counseling agencies in the community, where we also do support groups like the Help Room, which is completely chat-based and virtual, and also one that's on Zoom right now with a partnership with Woman Line, where we meet with survivors 4 times a month, different groups of them. We do advocacy, medical and legal-based advocacy, and we also do prevention programming in terms of Safe Bars, the Sexual Violence Prevention Course, and a number of coalition subcommittees and partnerships that we run and lead.
YWCA's Dayton Sexual Assault Services, we are accredited by the Ohio Alliance to End Sexual Violence, OAESV. We are the first and only accredited rape crisis center in Montgomery and Preble counties. To earn this designation, OAESV reviews our agency's work every 4 years according to the core standards of the rape crisis programs for Ohio. And now we're going to talk about the intersections between departments of YW and the different departments that we have within YW. We'll start with Leslie.
So I am Leslie Empostado. I am the Crisis Services Manager for the YW. And the Crisis Services line is our hotline that's open to survivors of sexual assault or sexual violence. They're able to connect with a crisis support specialist for any of the associated experiences or needs that someone who's experienced sexual violence may want more information about, or next steps or options. Callers call in and are asking for supportive listening very often, but also what are the resources and what are my options? What do I do about, filing a police report, or if it's been a recent experience, they may want to consider a sexual assault forensic exam. And our role, the role of the crisis support specialist, is just to affirm and support the caller, provide resource options or available options, process, what their most urgent need is, and then try to help get them connected to whatever the appropriate resource is. And always asking permission from the survivor and letting the survivor lead the conversation. So once we've, had the conversation, identified what their most urgent need is, then we connect them to the Rape Crisis Center in particular, if that's something that they want us to make a referral for. And then we also give them other resources in the community. And our role is just to try and connect people with the help they need.
Great, thanks, Leslie. Now Miranda's going to discuss rural communities and what we do in our rural areas.
Thanks, Amy. Like I said, my name is Miranda, and I am the rural advocate at YWCA Dayton in our Preble County office. So I'm working directly with survivors of sexual violence and other gender-based violence in Preble County and also in the rural Montgomery County areas, because there can be such a difference in services and access to services and the way that things are handled in these rural communities. And so it's important to us here at YW to make sure that there is access. We are in such a spread out area that sometimes just getting to us or getting to the hospital for those forensic exams is difficult for a survivor. And so we want to make sure that they can do that and make sure that they feel safe in reporting, because I've found that here in the rural community where there's this perception that everybody knows everybody and it's all about who you know and what you know, that survivors can sometimes be apprehensive to report their experiences with that fear that it's going to be talked about, people are going to find out, there will be retaliation, things like that. And so it was just really important to us here in our rural strategy office to make sure that that's not happening. We are working very diligently to have a good sexual assault response team in place so that these survivors have people to turn to and things like that. And then another thing that I can do is just be a support person for survivors and help them through that process of working through the trauma.
Thank you for sharing that, Miranda. It's important information to know. Now we're going to discuss the intersections between sexual violence and racial justice and toxic stress with Monika.
Hi, everybody. My name is Monika. I'm the Associate Clinical Director here at the YW. So what I'm responsible for is working within the domestic violence shelter with women who have been victims of domestic violence, sexual assault, and I work with our case managers to make sure that they're providing trauma-informed interventions and also looking for any mental health signs and symptoms that can present with women who've been victimized. So with that intersection of toxic stress, one of the things that I want to pay close attention to is the fact that we all have a different window of tolerance, meaning we all have a certain level of stress that our body can hold. And depending on that window of tolerance, that can elevate our nervous systems, or it can cause our bodies to have more cortisol that's kind of being introduced into our bodies, which heightens our startle response as well as our stress. So within that window of tolerance, you can kind of think of it like a cup, meaning once we've all experienced a certain level of stress, that kind of enters into our cup. And then when our cup starts to overflow, that's when we're operating outside of our window of tolerance. So what that means is you might notice that you feel more anxiety and more overwhelmed. You might notice that symptoms of mental health can present during that time, anxiety, depression, and PTSD oftentimes. So we're looking at the presentation of what can happen when women are operating outside of their window of tolerance. One of the other things that's important in the conversation is when we talk about toxic stress, we think about stress in three different ways. One, we have positive stress, then we have tolerable stress, and then we have toxic stress. So when you think about positive stress, that is all the day-to-day stressors that we all experience in our lives. So that's within our window of tolerance, meaning our bodies can hold it. It's not overwhelming our nervous system. We're able to emotionally regulate. It's not causing a huge disruption in our lives and in our relationships. So we have a certain level of homeostasis that we're able to come back to when we're at that positive level of stress. When we're at that second level of stress, the tolerable stress, it means that we're still within our window of tolerance, but those are the things that we call our small t traumas, meaning that can be embarrassment, it could be being guilted or feeling guilty around the things that have happened to you. It's anytime you internalize that sexual assault or sexual abuse that happens and you believe that you are the cause of the issue. And when that happens, you oftentimes will feel the guilt, you'll feel the shame, and you won't place the blame on the appropriate person or system that created that sexual assault or allowed that sexual assault to happen. So with the tolerable level of stress, what we see there is that women don't have the buffer to be able to have the level of support that they need to kind of externalize that experience so that they're not internalizing it in a way that causes a lot of guilt and shame. And then when you get to toxic stress, what happens is there you have no protective barriers, no protective boundaries. So what that means is you're internalizing the things that happen to you, you're blaming yourself, you're going through the whole conversation around, well, I should not have done, and had I not, if I had only. So you don't have those buffers in place that can kind of help you realign and to reassess the situation to say, it wasn't your fault, it wasn't anything that you did, or it wasn't anything that you caused. So when those are absent, then you have that heightened level of stress is operating outside of your window of tolerance. And not only are you internalizing a lot of negative core beliefs, and as well as a lot of negative self-talk, meaning the way that you refer to yourself in the situation that happened, you oftentimes start participating in risky behaviors or behaviors that can put your mental health at risk. The way that this aligns with racial justice is the women that we serve and the demographic that we work with, not only have those women been victimized, but what we also see is that they're also struggling with all the things that come with being in oppressive situations. So that means access or lack of access to mental health services, lack of access to transportation, housing instability, relationships that aren't intact or that are more problematic. So they don't have those levels of support. So when we're talking about racial justice, we're looking at all of the ways that microaggressions, racism, small t traumas, small interactions with people, whether or not it is indigenous populations, Latinx populations, or African Americans, all the ways that those things intersect, because those particular populations are oftentimes more victimized and they don't have access to those resources and those services to serve as a buffer when women have experienced sexual assault. So one of the things that we do at the YW is we serve as the buffer, meaning we advocate for women. We ensure that they have access to resources and services. We help them understand what toxic stress looks like, and we provide language, because a lot of the things that women are experiencing, it happens within a very cultural context. So that means not only is it pop culture related, but it's also ethnic culture, meaning a lot of the ways that we refer to sexual assault, a woman's role in sexual assault, how it happened, why it happened, whether or not what she was wearing was appropriate. All of those things factor into why we need to broaden the conversation around who is a survivor and how we define who she is in the language that we use in terms of her experience. So again, with the services that we provide that additional support for resources, for services, so that women are able to heal in a way that kind of mitigates some of those external factors, such as access to housing, inability to access transportation, childcare for their children. We mitigate all of those concerns and issues that women have so they can focus on their healing.
Oh, thank you, Monika. That was amazing information and so important to know all those different things. I learned so much just now as well. So we're going to go ahead and discuss some statistics with Megan.
So going off of what our wonderful friends here have said, Miranda and Leslie and Monika, is that, so why does it matter that we exist as a Rape Crisis Center program as part of YWCA Dayton? How prevalent is this within our community? And so looking at national statistics, and then we'll even look at a little bit of like local Dayton, Montgomery County statistics to see kind of why it is so prevalent and why we need to make sure that we're opening our lens in a way that we're not only just inclusive of all gender identities, but also through an anti-oppression lens and framework within our Rape Crisis Center. So every 73 seconds, an American is sexually assaulted. And that means that 433,648 Americans 12 and older were sexually assaulted or raped in the past year alone. 1 out of every 6 American women have been the victim or of attempted or completed rape in their lifetime, and 1 in 33 American men have experienced attempted or completed rape. And then 21% of transgender, genderqueer, or non-conforming individuals, college students, have been sexually assaulted, and compared to 18% of non-TGQN females and 4% of non-TGQN males. So keeping that in mind, that's a large population of an entire identity of individuals. And then when looking at the anti-oppression lens, 6 in 10 Black women report being subjected to coercive sexual contact by the age of 18. And RAINN, which is the national organization, estimates that out of every 1,000 sexual assault cases, only 230 are reported to police. And for every Black woman who reports rape, at least 15 of those do not report it. So we know that within our community nationally, those numbers are very high. And then on top of that, we can see the intersections within that of those who are not having access to being reported, not knowing their options, and knowing where to go. And then Amy will tell us about more of the local statistics.
And unfortunately, there's not a whole lot, there's not a wealth of information when it comes to local statistics, because there's not a whole way, like there's not a lot of people that are interested in the subject matter. So, but Montgomery County has the third highest rate among the larger populated counties, with a rate of 120 per 100,000 population reports of sexual assault. Our hotline, our crisis line alone, took 119 calls in 2019 and 85 calls in 2020, but that does not fully capture like the depth of the issue in our community. Some callers are reporting that COVID impacted their accessibility to services. There's a need for more evidence-based research. And like I said, there's a lack of subject matter experts in the area.
Yeah, so what can you do? So let's hear from our other panelists about just basic things that you as an everyday person can do to support survivors in our community. Leslie?
Believe survivors.
Miranda?
I would say just have their back and support them in a non-judgmental way.
Good. And Monika?
Help work with them through their feelings of guilt and shame.
Excellent. And then for more tangible ways that you can contribute to YWCA Dayton, if you would like to volunteer to help us make aftercare kits, to come in with prevention services, or to do anything else hands-on with us, you can email rflynn@ywcadayton.org. That's rflynn@ywcadayton.org. That's Rick Flynn, our volunteer coordinator.
And finally, to wrap things up, if you or someone you know is experiencing or has experienced sexual violence, our 24/7 crisis hotline is always available. That number is 937-222-SAFE, 937-222-7233. Thank you for coming.